Did you know that heart disease is the leading cause of death worldwide, claiming a staggering 17.9 million lives each year? That's a sobering statistic that should make us all sit up and take notice. The good news is that many cases of heart disease can be prevented or managed effectively if caught early enough. Recognizing the early warning signs of this silent killer could quite literally save your life or the life of someone you love. In this video, I'm going to reveal 10 crucial early warning signs of heart disease that you absolutely cannot afford to ignore. From subtle symptoms to surprising risk factors, this information could be the key to catching heart disease before it's too late. So grab a pen and paper and get ready to take notes, because knowledge is power when it comes to protecting your heart health. Let's explore these potentially life-saving signs together. Keep watching to the end for a guide about effective therapies and treatment options of heart disease. Did you know that chest discomfort is one of the most common early warning signs of heart disease? It's not always the dramatic, crushing chest pain you see in movies. Often, it presents as a dull ache, tightness, or pressure in the center of the chest. This discomfort may come and go, lasting for a few minutes or much longer. Pay close attention, as ignoring this symptom could be life-threatening. But that's just the first sign. There are many more to watch out for. Next up is a warning sign that many people brush off as no big deal, but it could be a major red flag for your heart health. Shortness of breath is another early warning sign that shouldn't be ignored. If you find yourself getting winded from activities that were once easy, or if you're constantly feeling short of breath, it could be a sign that your heart isn't pumping efficiently. This symptom is often overlooked, especially in older adults who may attribute it to aging or being out of shape. But it's a serious matter that requires medical attention. The next sign is something you might experience during a specific activity or situation, and it could be a major clue about the health of your heart. Have you ever experienced an unexplained feeling of fatigue or weakness, even after a good night's sleep? This could be a warning sign of heart disease. When your heart isn't working properly, it can't deliver enough oxygenated blood to your body's cells, leaving you feeling drained and exhausted. Many people dismiss this symptom as a normal part of aging or a busy lifestyle, but it's important to get it checked out. Coming up is a sign that many people experience but often brush off as insignificant, when in reality it could be a major red flag for heart trouble. Have you ever noticed your legs, ankles or feet swelling after a long day? While many of us might attribute this to standing or sitting for prolonged periods, it could actually be a sign of heart disease. When your heart is not pumping blood effectively, fluid can accumulate in your lower extremities, causing this swelling. It's easy to brush this off as a mere discomfort or a result of fatigue, but it's crucial to recognize this as a potential early warning sign, and recognize that it's time to consult your doctor. Up next, we'll be discussing a symptom that might seem unrelated to heart health, but could be a significant indicator of heart disease. Keep watching to find out what it is. Our hearts have their own unique rhythm, and any disruption in this rhythm can be a sign of a deeper issue. If you've ever experienced a fluttering sensation in your chest, or if your heart seems to skip beats or race for no apparent reason, don't dismiss it as just being nervous or stressed. These irregular heartbeats, also known as palpitations, could actually be a sign of an underlying heart condition. Many people mistake palpitations for anxiety or stress, but they could be a symptom of a more serious heart issue, like atrial fibrillation or arrhythmias. It's crucial to have these symptoms checked out by a healthcare professional to rule out any serious heart conditions. Stay tuned for my next early warning sign, often mistaken for something else entirely, but is a critical indicator of heart disease. Our bodies are designed for movement. Prolonged periods of inactivity can lead to a host of health problems, including heart disease. If you find yourself leading a sedentary lifestyle, be it due to your job or personal habits, consider this an early warning sign. Long hours of sitting can lead to weight gain, increased blood pressure, high blood sugar, and abnormal cholesterol levels, all risk factors for cardiovascular disease. It's not just about hitting the gym or running a marathon. Incorporating regular physical activity into your daily routine, like walking, biking, or even gardening, can make a huge difference. Break up long periods of sitting with short bouts of activity, and your heart will thank you. In the next scene, I'll explore another lifestyle factor that can significantly impact your heart health. I know that you find this video informative so far, and will continue to find the rest of this video informational and very educational, so go ahead and give me some support. This is simple, easy and free of cost, but significantly very important. It will only take a few seconds of your time, and like I mentioned before, it will cost you nothing, but will help to grow my channel and also enable me to spread more valuable needed information like this. Now, click on that thumbs up button. It's a simple act, but the impact can be massive. Imagine that simple click as a ripple in a pond, extending outwards to touch and influence others to become more conscious about becoming more informed about their health and well-being. It also helps to spread much-needed important information to a wider audience, which can potentially make a change in someone's life. So go ahead, show your appreciation for these types of informative videos. Click that thumbs up button to potentially make a change. Now, to ensure that you don't miss out on any more valuable content, click the subscribe button and the notification bell that is beside it, then select all to gain access to all the other videos on my channel and to stay up to date with any new ones that gets posted. Most importantly, subscribing is absolutely free. My channel isn't just about sharing, it's about building a community of knowledge seekers who understand the importance of staying informed and updated when it comes to a healthy lifestyle. If you're a smoker, or even if you've been exposed to secondhand smoke, this next early warning sign is especially important for you. Persistent coughing or wheezing could be your body's way of telling you that your heart isn't getting enough oxygen, and therefore it's time to pay attention. This is a serious concern and should not be ignored. Smoking is a major risk factor for heart problems as it damages the blood vessels and increases inflammation. This is not just a minor annoyance or something to brush off. It could be an indication of an underlying heart issue. Remember, when it comes to your heart health, there's no such thing as a symptom too small to overlook. Stay tuned for the next early warning sign. It's something that many people experience but often ignore, thinking it's no big deal. But when it comes to your heart health, it's a symptom that should not be overlooked. If you've been feeling unusually full lately or losing your appetite for no apparent reason, it's time to pay attention. This could be more than just an off day or a lackluster meal. This could be your body's way of indicating that your heart isn't pumping blood as efficiently as it should. When the heart isn't functioning properly, it can affect your digestive system, making you feel full quicker or reducing your appetite. This may seem like a minor inconvenience, something you can just brush off. But in reality, it could be a red flag signaling a more serious underlying condition. So don't ignore these signs. Listen to your body. It knows when something isn't right. Up next, I will be talking about a warning sign that's linked to a specific physical characteristic or condition. It's a sign that you might not immediately associate with heart disease and could easily be overlooked. Our next early warning sign is a subtle change in your physical appearance that you may not immediately link to heart disease, paleness, or an unusual pallor. When your heart isn't pumping blood as efficiently as it should, it can lead to a decrease in the number of red blood cells circulating in your body, which in turn can cause your skin to look pale or ashen. This is more noticeable in lighter-skinned individuals, but people with darker skin tones may notice a yellowish or greyish tint. This can often be mistaken for a simple lack of sun or even anemia. But if you notice a persistent change in your skin colour accompanied by other symptoms that I have discussed, don't write it off. It's crucial to get it checked out, as it could be a sign of an underlying heart condition. My final early warning sign takes us back to the brain. I am talking about frequent or unexplained dizziness or lightheadedness. When your heart isn't pumping blood efficiently, it can lead to a temporary drop in blood flow to your brain. This reduction in blood flow can cause dizziness or a feeling of being lightheaded. Many people dismiss these symptoms as minor annoyances or attribute them to something else like hunger or lack of sleep. However, if you're experiencing these symptoms frequently or without an obvious cause, it's time to take them seriously. They could be clear indicators of an underlying heart condition. Remember, it's always better to be safe than sorry when it comes to your health. So don't brush off that unexplained dizziness. It might be your body's way of telling you that something is not right. Keep watching because you do not want to miss the information that I will be sharing in the next scenes with regards to crucial aspect of managing heart disease. In this scene, I will be focusing on a crucial aspect of managing heart disease, lifestyle changes. You've probably heard this before, but it's worth repeating. The way you live your life has a significant impact on your heart's health. Let's start with diet. Cutting back on harmful elements such as saturated fats, trans fats, and sodium can do wonders for your heart. Instead, try to load up on fruits, vegetables, whole grains, and lean proteins. But diet is just one piece of the puzzle. Exercise is another game changer. Aim for at least 30 minutes of moderate activity most days of the week. It could be as simple as going for a brisk walk or hitting the gym. The key is to get your heart pumping and your body moving. Remember, these changes don't have to be drastic or immediate. Start small and gradually incorporate these healthy habits into your routine. It's all about making sustainable changes that you can stick to in the long run. And trust me, your heart will thank you for it. In upcoming scenes, I go a little deeper into more specific therapies and treatment options for heart disease, so do not go anywhere. On the journey towards a heart-healthy lifestyle, the role of medication cannot be ignored. For many individuals battling heart disease, medication is a critical part of their treatment plan. Your doctor may prescribe different types of drugs based on your specific condition. These could range from blood thinners to cholesterol-lowering drugs or medications to manage high blood pressure. It's crucial that you take these medications exactly as prescribed. Not doing so can have serious consequences. Also, remember that every medication can have side effects. If you experience any discomfort or notice anything unusual, don't hesitate to communicate with your healthcare provider. They're there to help you navigate through this journey. Remember, medication is not a standalone solution, but a part of the comprehensive approach towards managing heart disease that includes diet, exercise, and lifestyle changes. Stick around for the treatment options. In some cases, your doctor might recommend surgical interventions as part of your treatment plan. This can be a daunting prospect, but it's important to remember that these procedures can be life-saving for those with severe heart disease. Angioplasty, for instance, is a procedure that's used to open blocked or narrowed coronary arteries. Similarly, stenting involves the placement of a small mesh tube to keep the artery open. Bypass surgery, on the other hand, redirects blood flow around a blocked or narrowed artery. Each of these procedures has its own benefits and risks, which your doctor will discuss with you in detail. It's crucial to ask questions and understand all your options before making a decision. Remember, the goal of any treatment, surgical or not, is to improve your heart's health and your quality of life. In my next scene, I will discuss another crucial aspect of managing heart disease. Heart disease doesn't end with diagnosis or even after surgery. The journey of recovery and maintenance is ongoing. This is where cardiac rehabilitation comes into play. After a heart attack or heart surgery, cardiac rehabilitation programs can be incredibly beneficial. These programs, often recommended by healthcare professionals, typically involve supervised exercise, education on heart-healthy living, and support for managing stress and emotional well-being. The goal is to help you regain strength, prevent your condition from worsening, and reduce your risk of future heart problems. It's a comprehensive approach that empowers you to take an active role in your health. So remember, after the storm has passed, the real work of healing begins. In the battle against heart disease, knowledge truly is power. By understanding the warning signs I have discussed today and taking action promptly, you can significantly improve your chances of maintaining a healthy heart. For more information on heart disease prevention and treatment, consider visiting reputable sources like the American Heart Association or consult with your healthcare provider. Remember, a few simple lifestyle changes, such as maintaining a healthy diet, exercising regularly, and quitting smoking can go a long way in reducing your risk of heart disease. Don't wait until it's too late. Prioritize your heart health today and take the necessary steps to protect one of your body's most vital organs. The information provided in this video is intended for educational and informational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare professional or a registered dietitian before starting any new diet or making significant changes to your eating habits, especially if you have underlying health conditions. Your health is your most significant asset, and it's crucial to make informed decisions under the guidance of professionals. Remember, there isn't a one-size-fits-all solution to health, and what works for one person may not work for another. Therefore, use this information as a starting point and work with your healthcare provider to make the best decisions for your health. Thanks for tuning in. Remember, take action today for a healthier tomorrow. And in the meantime, keep an eye out for my next upcoming video. Until then, stay healthy, stay happy, and keep learning.